Go. Okay. Good morning. This is Lynnette Leone's intramuscular injection checkoff video. So, I'm going to start. I'm in an endoscopy unit and I have an order for, the doctor's ordered midazolam for a patient who's going to undergo a short endoscopy procedure for a food bolus. So the first thing I'm going to do is I'm going to start over here at the MAR. I'm going to do hand hygiene. I'm going to check the MAR to find out what the order actually is. My patient's name is Fletcher Biceps, and he is a 30-year-old. On the MAR it says he has no known allergies. He has an order for midazolam 1.5 milligrams IM stat. So the first thing I'm going to do is I'm going to gather my supplies. For that sort of an injection, I'm going to need a 3 milliliter syringe and a 23 gauge 1-inch needle. I'm also going to need a couple of alcohol swabs, and I would also take a band. Okay, so now I have my supplies. Starting with my first med check, which is I look in the MAR, midazolam 1.5 milligrams IM. I'm going to the cart. There it is. I pull that out. Midazolam 1 milligram per milliliter vial. First check done. Next thing I'm going to do is I'm going to check this vial against the MAR. Midazolam 1 milligram per milliliter, midazolam 1.5 milligrams IM, second check done. Okay, so now I'm going to check in my drug book. When I look in here, I notice that midazolam is a high alert medication because it has central nervous system depression effects, and in this case I'm going to need to check my med with another medical professional, so I will remember to do that. Okay, and my last thing I'm going to do is I'm going to draw up the medication. Starting here, first thing I do is clean the top of the vial with an alcohol swab. Let that dry while I am preparing my syringe. I'm going to do this sterilely by opening the syringe packet this way, draw it out. From here, I open my needle packet sterilely, and I attach my needle. Let me get rid of a little bit of this junk so that I can see what I'm doing. Okay, and then I draw back the safety. I'm going to uncap. I'm going to set my needle cap there. Okay, and so I noticed because I have 1.5 milligrams and this is 1 milligram per milliliter, I know that I need 1.5 milliliters of the medication. So in this case, I'm going to draw 1.5 milliliters of air into my syringe, and then I'm going to inject that directly into the top of the vial. Okay, so I inject the air. Now I'm going to withdraw some medication, so I turn this up this way, and I start withdrawing medication. In this case, I'm going to withdraw a little bit more because, as you can see, I'm getting kind of a large air bubble there, so I'm going to draw a little bit more than 1.5 milliliters. From here, I would flick out all the bubbles. So now that I have all the bubbles out, I'm going to retract to exactly 1.5 milliliters. Then I'm going to withdraw. Using the scoop technique, I'm going to recap the needle. That didn't touch anything, luckily. So now I have my needle recapped and it's ready to go. It's like 1.5 to me, but I'm going to need to check with this other person. And they say yes, they agree. They're checking against the original order and the dosage. So now I look like at 1.5 milliliters. And now I'm going to clean off the top of my cart. Clean off the top of my cart and put this medication away. And as I'm doing that, I'm going to check midazolam, 1 milligram per milliliter, midazolam, 1.5 milligrams, 1.5 milliliters in the syringe. I'm going to return this to the cart. Third check done. Now I shut the cart, lock it all up. Nope, before I lock the cart, because this is a high alert med, what I would want to do is also bring a reversal medication in case the patient has a respiratory crisis or something, and in that case I would bring romazicum. Okay, now I've locked up the cart. Now I'm going to bring the medication and the drug, the MAR and the shot to the room. Knock, knock. Good morning, sir. This is my nurse's station here. I would never put this on an over bed table. So I'm using this as my nurse's station. He also has an over bed table here. Okay. Good morning, sir. I'm going to do some hand hygiene. My name is Lynnette, and I am the nurse that's going to assist in your procedure today. So the doctor's ordered you to have a shot that's going to help with your comfort level during this procedure. It's called midazolam, and I'm going to need to give you a shot in basically right up here in your upper hip. So first, before we begin, can you tell me your full name and date of birth?
Fletcher Bicep, September 16th, 1985.
Okay, thank you. I'm just checking your armband to make sure that it matches you, and I'm also checking to see that whether or not you have an allergy band. I'm noticing that you don't. Can you tell me if you have any allergies?
No, I don't.
You don't. Okay. All right. So this medication is going to help you relax, and it's going to kind of help you be a little bit sleepy. It's not going to put you all the way out. But what it is going to do is when the procedure is over, you might notice that you don't quite remember all of it, and that's because of the way that the drug works. It doesn't really, that's completely normal, and it's nothing really to worry about. But did you have any questions before we start?
No, I don't think so. Thank you.
Okay. Before we do anything else, I need to get a baseline set of vitals on you, so I'm going to take your blood pressure. Take your blood pressure, I'm going to take your temperature, I'm going to take your pulse, and while I'm taking your pulse, I'm going to take your respirations. I'm saying this out loud, but I would not say this to the patient. That's what I'm doing right now. I'm also going to attach an O2 sat monitor on his finger. And once I get a baseline set of vitals, what I'm going to do is I'm going to leave this blood pressure cuff on your arm and this O2 sat monitor on your finger during the procedure so that we can just make sure that you're breathing good, breathing okay, or you're breathing regularly. And now that I've done that, I'm going to go ahead and start with the injection, okay?
Okay.
So hand hygiene. Before I put gloves on. Okay, I'm going to go ahead and expose the area where I'm going to give you the shot. Like I said, it's going to be right in here. And then I'm also going to raise the bed. Nope. So now I'm going to do hand hygiene. gloves on. Okay, he told me his name, and that's why I have the MAR in here. He says his name is Fletcher Biceps. He told me his date of birth and that he has no known allergies, and that's what the MAR says. I'm gonna drop my alcohol swab. Does this do? Okay. Okay, I have my alcohol swab. So, for this injection, what I would do, I'm going to leave this here so I can demonstrate what I would do first, and then I'll give the shot here for the purposes of the video. Alright, I'm going to give a ventrogluteal IM injection. So how I would do that is I would start by using the heel of the palm of, or the heel of my hand, would place that against the greater trochanter, and I would have all of my fingers pointing toward the head of this patient, with my first finger on the anterior superior iliac crest. I would use that. Then I would separate my first and second finger, and I would get my landmark right between those two. Now, because we're going to do a Z-track IM injection right now, what I would do is I would keep my eyes on that landmark as I pulled my fingers back. Okay, so that's where I would give the shot in this patient, but for the purposes of the video, we're going to actually give that shot in this injector pad. Okay, so the first thing I'm going to do is I'm going to clean the area with an alcohol swab. I'm going to let that dry. Back with this hand because I'm going to give the injection with my dominant hand. Okay, so I'm going to imagine that this area is now dry. So, like I mentioned before, how I would be pulling this off, how I would be doing this Z-track is that I would have found my landmark and then I would pull back. Okay, so that's what I'm going to do. So I found my landmark right there, pull back, and then I'm keeping my eye on that landmark spot, and I inject straight into the muscle. Now I aspirate a little bit, make sure I don't have any blood. Then, because this is a 1.5 milliliter dose, I'm going to inject over 15 seconds, 14, 15. I pull straight out and let go. Now the next thing, the most important next thing is to put the safety on here. And now I'm going to get rid of this in the sharps container. And so the injection is done. So now I'm going to tell Fletcher, so that injection is done. Do you have any other questions about that?
No, I don't think so.
Okay, are you feeling all right?
Yes.
All right, that medication is probably going to start taking effect in about 15 minutes or so. So you'll start feeling that. I made sure that you have your call light, which I don't see here. Does this? Okay. But anyway, I'm giving you your call light. Remember that my name is Lynnette, and I'm going to be back to assist during this procedure in a little bit. I'm checking to make sure that your room is free of clutter. Okay, so you just go ahead and relax, and we'll be back after a bit. So now I am taking gloves off. This is going to go in the garbage. There isn't one in this room, but this is going to go in the garbage of this room. I'm going to do hand hygiene. I'm going to go document this procedure. So when I document, I'm going to document that today's date is November 19th, that I gave a ventrogluteal IM injection Ventrogluteal IM injection. My initials of midazolam. My initials. So the date, the time, and I'm also going to say that it is 9:55. Yes. Okay. So what I'm going to do is I'm going to document the date and today's date, the time that I gave a right ventrogluteal IM injection, and initial it.